Worried about blood clots and want to thin your blood? There are actually several ways to do this, and there are pros and cons to each one of these. In this video, I talk about prescription medications, over-the-counter medications, and supplements that you can take to thin your blood and prevent clots. I'm Dr. Jacob, naturopathic medical doctor and integrative physician in Salt Lake City, Utah. On this channel, I share with you how you can heal your body down to the root causes without any harmful drugs or surgery. Be sure to subscribe for more videos like this one. Okay, let's jump in. If you want to thin your blood and get rid of blood clots, here are your options. What are the three things that we can do to thin our blood? One is prescription medications. Another is over-the-counter medications, or some of my favorite are actually supplements that we can take to thin the blood. So we have several different medications that can thin the blood. They're in several different categories. We have one in one category, the Warfarin, Coumadin. We have another category that's the Eloquis and Xarelto. We have another one that's Pradaxa, and then we have Heparin. They all do different things. There's pros and cons to all these blood clotting medications. But yeah, we're diving into like what does what and what does other, and what would I recommend over any other blood clotting agent. So let's dive into like Warfarin and Coumadin. This is probably my least favorite blood thinning medication. I'm sure several of you listening have heard of this medication and probably have family members or friends that are on this medication. How it works is it decreases an enzyme. It's called a complex of enzymes. It's your vitamin K epoxide enzyme complex is what Warfarin does. It binds to that and prevents that. That's why you don't want to be taking vitamin K with it, or you don't want to be eating leafy greens or a lot of vegetables when you're on Warfarin, because that's going to diminish the effect of Warfarin and your clotting is going to increase when you do that. I don't like this medication because a lot of the things that we do to actually prevent forming blood clots without medication is from vitamin K foods, containing foods. And I want to put this aside too, is sometimes people are like, oh, I'm anti-vitamin K because that's going to increase my clotting. I'm at risk for clotting, so I'm going to not eat the vitamin K. That's actually going to increase your risk because you're decreasing a lot of the foods that are actually healthy for preventing the blood clot, that are anti-inflammatory, going to decrease the inflammation around the blood vessel. So yeah, you don't want to eat it with Warfarin, but you definitely want to eat these leafy green vegetables when you're not on Warfarin. Let's dive into some of the other ones that I don't dislike as much. I don't necessarily love them, but they are needed in certain circumstances. That is Eloquis, Xarelto, Lixiano. These medications work by binding to factor XA and also a little bit to prothrombinase. What this does is it leads to decreased production of thrombin, which produces all of these clotting constituents that increase your clotting. So it works completely different than Warfarin. You don't have to limit your vitamin K. You can eat all the leafy greens. There's no problem there at all. We do also have another medication called Pradaxa, which is somewhat similar to these medications, but it does work differently. It binds directly to the thrombin itself and prevents all those clotting constituents that go along with thrombin. Next one I want to talk about is heparin. This is not something that you're going to be taking every day to prevent blood clots. This is usually used in the hospital setting. It's done via IV, but I wanted to talk about it because when you do have blood clots, you're going to be put on heparin. And this blocks antithrombin, which is involved in making blood clots. So it blocks antithrombin. So they all prevent blood clots, but they do it in different ways. Probably my favorite one out of them all is probably in the class of Eloquis or Xarelto, because you can still eat healthy, but still you're going to be at risk of forming blood clots in the future. So when you cut yourself, you're going to bleed a lot. So whatever we can do to help prevent the blood clots without medication probably would be the best answer in my opinion. So over-counter option for decreasing blood clots is aspirin. Most of us have heard about it. We've heard of low-dose aspirin to help prevent blood clots, heart attacks, strokes, etc. It works pretty well, even though research is a little bit more limiting on actually preventing heart attacks and etc., even though we've been doing it for 30 years. But it is a good, safe medication that's not going to cause a lot of harm. Compared to the others, you're not going to bleed out if you have a severe injury or anything like that with aspirin. And then let's go into all the supplements that we could take to help prevent blood clots. I'm going to dive in the mechanism of action of how they work. So one of my favorite ones is turmeric, specifically curcumin. How it works is it actually decreases the congregation. It means the packing of the platelets together decreases that, but also works similar to Eloquis, is it actually decreases factor XA in prothrombin. So interesting thing, and they've actually done a comparison with these, and they both work really well with decreasing blood clots. But the side benefit that come along with curcumin is that it's anti-inflammatory. So you're decreasing the clot, but also you're decreasing the inflammation that actually causes the clot. A clot is never going to form if you don't have a lot of inflammation around your blood vessels. So it actually decreases that inflammation and also prevents the clot from forming altogether. So it is a fantastic treatment that we can use to help prevent blood clots, because it's doing 100 other mechanisms of actions. I mean, I love turmeric. It does so many different things. It's one of the supplements I actually take just every day because of all the effects that it has. But yeah, very safe for prevention, and also if you have current blood clots. Another treatment is garlic. So you could eat a lot of foods with garlic, but also you want to take a supplement to really look at the research and dosage forms. We've seen dosages of 600, 1200, 2400 milligrams of garlic. And what this does is it decreases platelet aggregation. That means that the clumping of the platelets together helps decrease that clumping that happens that leads to the blood clot. So that's how garlic works. And then we're going to move on to fish oil. So fish oil doesn't have direct anti-clotting effects like the previous two that I talked about, but it does decrease the stickiness of the blood, which then can form a blood clot. A big piece of what it's doing is decreasing the inflammation in the body, especially around the blood vessel, and also inflammatory cytokines that increase the risk of forming blood clots. So that's how fish oil works. Now, you do have direct anti-clotting effects that if you go really high in EPA, which is a constituent in fish oil, like 10,000 milligrams, which is just not something you're going to be taking supplementally. It can have that anti-clotting effect. But really the great effect of fish oil is the anti-inflammatory effect it has throughout the body. Now we're going to move on to probably the strongest out of everyone that I've talked about is Nanokines. And what this does is actually helps hydrolyze the fibrin of the clot. So let's say you already have a clot, Nanokines helps break down that clot. Turmeric and garlic can do a decent job at doing that. Same with all the anti-thrombin medications that we just talked about. But this works even better in that regard because it helps break down that fibrin around the clot. So what I do to decide if I need to put someone on a prescription medication or is it okay just to be on the aspirin or the supplements is really the severity of the condition and how bad the condition is. If someone has a history of heart attacks, and let's say they have about 90% blockage or 80% blockage, and they're not really doing anything like getting that taken care of, like putting a stent in or anything, they definitely need to be on probably a stronger blood clotting agent. Or let's say someone's starting to form blood clots throughout their entire body, like was happening with your husband, is that we want to probably take the prescriptions in that case. But if it's not as severe, you are at risk of heart attacks, maybe you've had a heart attack in the past, I think and it's all depending on what I think when I'm seeing the patient, I'm seeing their labs, I'm seeing what their history and what's going on, where I decide if they're going to do a medication or not. But many instances, I'm able to do more natural agents and I feel comfortable with that and it can work really well. But there's other times that I don't feel comfortable with that and I need to prescribe a prescription. So I can't say exactly I'm going to do this or this, but it's really just based on the severity and where the patient is at when they come into my office. You don't want to be taking a supplement that thins the blood with a current anti-clotting agent like prescription like Warfarin or Eloquis, etc., because that's going to increase your risk of bleeding. So this medication already increases your risk. You're going to even make the risk even worse when you take these agents. So you don't want to do them in unison to each other. But one you can take is fish oil. Even though the doctors are going to say you can't take fish oil, the research isn't there to actually say that's going to increase your clotting risk. So I don't worry about fish oil too much, but turmeric and garlic and Nanokines definitely can be an issue. If you want to learn more about blood clots, heart attacks, strokes, click on my video to the right. I'm Dr. Jake, and I'll see you there.